In this video, I'm going to outline my top 4 mistakes in back pain care and what you can do to avoid them. Hello and welcome to the Back Pain Guide. I'm Duncan, a former sufferer of debilitating back pain, now turned physiotherapist who focuses on the treatment and care of other people, perhaps like yourself, who also suffer from back pain. The advice I offer on this channel is a mixture of my personal experience and professional expertise, and I try and focus on answering questions I wish I had known the answers to when I was suffering from back pain. So none of us are perfect, we all make mistakes, that is totally acceptable and I would say inescapable part of life. However, when it comes to suffering from back pain, there are certain mistakes I see people make over and over again. And when we're able to intervene and stop them repeating that same mistake, their back pain normally takes a massive leap in the right direction. So in this video, I want to outline my top 4 back pain mistakes, and I've chosen these based on a combination of being the ones that are generally the most detrimental, and the ones that are normally the easiest to spot and can normally be fixed simply by making the deliberate choice to fix them. Now, that's not to say that these mistakes don't take some effort and care to be fixed. However, the solution is not normally particularly complicated. It just simply needs to be done. As Ronnie Coleman would say, there ain't nothing to it but to do it. Now, I have put these in ascending order of importance, so please stick around for the last one because it's the one I find to be the most valuable and the one I think everyone should be doing. So, the first mistake in back pain care, treating the victim, not the villain. So it's a common scenario that when someone experiences back pain, they come and see a professional, a physiotherapist, osteopath, or chiropractor, and they say something like, well, I've got pain in my lower back, located to the right side of my lower back. So of course, that therapist will start treating the area that's experiencing pain. Now, this of course isn't inherently a bad thing, but what we often see with particularly more complex back pain patients or people who have been experiencing more chronic pain, the pitfall they fall into is that they are treating the victim of the problem, not the villain or creator of the problem. So we know from the concept of regional interdependence that different parts of the body are both anatomically and functionally linked. So that means that dysfunction in one part of the body can be the cause of pain in a different part of the body. So what this normally means is that one part of the body isn't doing its job properly. It might be too weak, too stiff, too immobile, something like that, and is therefore causing some type of dysfunction. That would be the villain. The other part of the body is overcompensating for that dysfunction and thus experiences the pain. That is the victim. Now, although it can be valuable to treat the victim, particularly in acute phases of a back pain flare-up, if you don't identify and treat or correct the dysfunction in the villain, you'll never truly fix the cause of your back pain and thus likely continue to have repeated issues and chronic pain. So a problem we often see in clinic is people who come in with pain in their lower back, pain around their lumbar spine. This is the victim. However, when we do various physical tests, see how they move, see which parts of their body are working as they should and which aren't, we often see that particularly due to our modern sedentary lifestyles, spending a lot of time sitting, hunched over a computer, that sort of thing, what we see is that actually the cause of the problem is the fact that their T-spine, their thoracic spine, which is the part of the spine that sits above the lumbar spine, the vertebrae that attach into the ribs, that has actually become very stiff and immobile. So, in order to compensate for that dysfunction in the thoracic spine, the lumbar spine starts to overcompensate and start to move in ways that it's not particularly good or designed to do. It bears too much weight, it bears too much load, and over time, this causes problems. So you see quite clearly here that we have a clear victim, the lower back, overcompensating for dysfunction in the villain, which is an immobile or stiff thoracic spine. So in this scenario, yes, of course, in the acute stages, We will treat the lumbar spine, the victim in the process, to reduce pain and so forth. However, if we then don't go on to identify and treat the dysfunction in the villain, the thoracic spine, the problem is likely to recur over and over again. So how do you fix this issue? Well, you need to find a therapist who is wise to this reality and does a thorough assessment of your condition to make sure they are identifying not just the victim of the problem, but the villain too. What I tend to do in clinic to identify both victims and villains is a thorough, standardized movement assessment. I tend to use, and I really value, the template from the Functional Movement Systems, which is a wonderful, very, very thorough physical assessment and screening developed by Gray Cook and his team in the US. I highly recommend this system. However, there are other systems that can be utilized which can also be effective. Now, of course, like with most things to do with back pain, it might not necessarily be a simple binary, one villain causing one victim, and there may be multiple villains causing someone's problem, and they might not all be biological or physiological. There may be emotional reasons, psychological reasons, social reasons, and so forth, all contributing to the victim. However, whatever method your therapist uses to treat you, it is essential that the villain, the cause of the problem, needs to be identified and treated if you truly want to get to the root of your back pain and fix it for good. The second major back care mistake, this is a really simple one, not keeping up with rehab. There is really very little to say about this because it's quite simple. So of course, a common scenario we see in clinic is someone comes to see us, they're in quite high levels of pain, their issue is affecting their life and stopping them doing the things they love. And of course, during this period where we see them for some treatment over the course of a few days or a few weeks, people do normally tend to be quite diligent in performing the exercises, the treatments that we give them. Now, after this initial acute phase of pain has ended, the patient is in what I consider to be an essential nexus point of their treatment and care. What will often happen at this point, and this is completely understandable, is that now the pain isn't so prominent, isn't causing them so much distress in their life, it will inevitably fall down their list of priorities. We're all busy, we all have lots to do. This is completely understandable. However, the consequence of this is normally the treatment isn't complete and the pain will likely resurface at some point in the future. The alternative of what might happen at this crucial nexus point of someone's care when the acute phase of pain is over is that patient will retain some level of diligence to their exercise program. The difference in outcomes between these two choices, these two decisions, either stopping caring about your rehab exercises or retaining some sort of adherence to them, is normally like night and day. And those people that stick with it normally have far better outcomes than people who forget about doing their exercises, doing their rehab. Now, of course, a rehab program is a topic all in itself and can be quite complex. And of course, the exercises that you're given, let's say a week after an acute injury, shouldn't be the same as the exercises you're doing 2 months after an acute injury. But some diligence, some adherence to rehabilitation style exercises is possibly the most crucial thing you can do in the long-term care and treatment of a back issue. The third major mistake in back pain care, not treating the problem holistically. Now, I know a lot of people can be somewhat allergic to that word, holistically, but please bear with me. I'm not trying to sell you any crystals or essential oils here. So until not too long ago, we were treating back pain purely from what we call a biomedical perspective. We were looking for what problem in the body, in the body's tissues, was causing someone's pain. We now know that back pain in most cases is what we call a complex biopsychosocial issue, which means there are multiple factors, not just physiological, not just biomedical, that can contribute to someone's pain, to someone's back issue. This can involve stress, psychological issues, emotional issues, issues with work, sleep deprivation, all sorts of things that play into the complexity of someone's back pain. So just as a personal anecdote to illustrate this point, for me, I used to always get flare-ups when I was stressed about something. And by that, I mean there was rarely a physical event or action that caused me to have a back pain relapse. I never hurt my back at the gym. I never hurt my back, helping someone move house or tying my shoelaces or any of these common sort of physical events that sometimes people blame for their back pain. And in fact, the last time I had a particularly significant relapse or flare-up of my back pain was back in 2019 when we found out my wife was pregnant for the first time. Now, although it was extremely happy and welcome news, for whatever reason, I was extremely stressed and anxious about the results of the first scan. At that point, for what felt like the first time in some years, my back just went on me. It started to spasm and I was basically bedbound for 2-3 days and in quite significant pain for a few weeks after that. So knowing what I know now, I can recognize that psychosocial aspect of my back pain, the anxiety and stress element, which can help me to manage it. So if I do recognize I'm in a particular period of stress or anxiety in my life, for whatever reason, I can now take steps to mitigate against it having the same impact on my back. So instead of constantly looking for the physiological reason for your back pain, did you pull a muscle at the gym? Did you sleep funny? Did you sit for too long? When armed with this knowledge, people with back pain often start to see consistent psychosocial reason for why their pain flares up. So for me, it was stress. For you, it might be stress. It might be anxiety, depression, lack of sleep. Whatever the reason, these potential contributors are every bit as important as any damage or irritation to body tissues. So my advice here is to make sure that both you and your therapist are both acutely and actively aware of this reality and consider the non-biomedical elements that might be contributing to your back pain. And the final, and in my opinion, most important mistake people tend to make in their back pain care, being fearful of movement. I know back pain can be quite scary, it can be very painful, it can be quite debilitating, and there's a lot of misinformation and harmful beliefs out there which make people start to think that their backs are fragile or weak or crumbling or susceptible to further damage and injury. This fear of exacerbating pain or causing further damage often leads to what we call avoidance behaviors, where people restrict their physical activities to prevent further pain and damage. Although completely understandable, the problem with this type of fear avoidance behavior is that it often leads to what we call the cycle of deconditioning, where reduced physical activity often leads to weakened muscles and reduced mobility, making the back more susceptible to further injury and chronic pain. On top of this, and going back to that biopsychosocial aspect, fear and anxiety can also exacerbate muscular tension, potentially aggravating existing pain. Moreover, and importantly in this regard, when someone avoids movement due to the fear of pain, they often reinforce the generally false notion that movement is harmful, creating a negative reinforcement loop that intensifies not necessarily the pain, but the perception of pain. My advice for this is please recognize, even if you are in the depths of an acute phase of a back flare-up or a back pain relapse, your spine, your back is a strong and resilient feature of your body. And in the vast majority of cases, what most people with back pain need is more movement. Now, not necessarily doing backflips when you're in the depths of an acute phase of pain. However, you need to find the sweet spot of the appropriate amount of movement for you at this phase of your recovery and gradually build on it over time. This is the way to fix a back problem in the long term, and doing the opposite avoiding movement, avoiding certain things you love, fear avoidance behaviors, is a surefire way to make sure your problem never goes away. So there you have it, my top 4 mistakes people tend to make when treating their back pain. I'm very curious, do any of these apply to you? Perhaps you think I've missed one of the major mistakes people tend to make. Please let me know in the comments below. I'm very curious to hear your thoughts. I hope you found that information useful. Remember, you have the power to take control and move towards a pain-free life. If you enjoyed the video, please give it a thumbs up and consider subscribing to the Back Pain Guide for future videos and more valuable content. If you have any questions or perhaps suggestions for future videos, please leave them in the comments below. I'm here to guide and support you on your journey to recovery. Thanks for watching the video, and I'll see you in the next one.